This lecture is about teeth setting and balanced occlusion. Teeth setting is like arranging a Rubik's cube. You should look at all the sides of the cube. So we look at the labial side or labial view, profile view, and occlusal view of the teeth after setting. We always start with setting upper central incisor. The long axis of the tooth should diverge slightly from the midline. So the long axis goes distally. The neck of the tooth goes distally while the incisal edge is medially. The incisal edge touches the occlusal table of the articulator. Labially, the neck of the tooth is depressed by 2 millimeters when we look at the tooth from the side or the profile view, and the incisal edge is in a line with the wax rim. Next, the upper lateral incisor. The incisal edge is positioned parallel to the occlusal plane, but it is 0.5 to 1 millimeter above it, so there's no contact between the incisal edge of the lateral incisor and the occlusal table of the articulator. The neck of the tooth is depressed more palatal than the central incisor when we look from the side. On the tooth, the long axis of the tooth is angled more distally than the central incisor. The upper canine is placed at the angle of the mouth. When we look at the long axis of the canine, it's perpendicular to the occlusal plane or the occlusal table of the articulator, and the cusp is touching the occlusal table. The neck is more prominent than the tip of the canine. The labial surface of the canine is continuous with the labial surface of the wax rim and also with the labial surface of the central incisor. After setting the upper 6 anterior teeth, there should be a harmony in the general arrangement of the anterior teeth. We will talk about this in details in the following slides. So we're going to be talking about harmony of the incisal show and the patient's age, harmony of teeth with the smiling line of the lower lip, harmony of the dental arch form and the form of the residual ridge, harmony of the long axis of central incisors with the patient's face, harmony of the opposing labial and buccal long axis of teeth, and harmony of the teeth and the profile line of the patient's face. After setting, there should be a harmony of the teeth with the smiling line of the lower lip. So when a line is drawn connecting the upper anterior teeth, this line should follow the curved line of the lower lip during smiling. And as we said before, that upper canines are responsible for the shape of the smile line because they make the vertical stops at the corner of the mouth. We talked about this before, that the shape of the arch should be in harmony with the setting of anterior teeth. So for each arch shape, there should be a special teeth setup. There also should be a harmony between the long axis of the teeth with the long axis of the face. To give a natural appearance. As you notice that the long axis of teeth on the right side is not parallel to the long axis of the teeth on the left side. But we follow the same rules during setting, and this is what we call asymmetrical symmetry. They are asymmetric, but at the same time we have symmetry in the setting. So the teeth on the right side tip or they have their long axis distally, and the teeth on the other side they have their long axis distally. Then we move on to setting of mandibular anterior teeth. The lower central incisor is arranged over the ridge or slightly labial to the ridge, and it is set perpendicular to the occlusal table. Lower lateral incisor and canine are distally inclined. When we look at the teeth from the labial aspect, the lower canine are more distally inclined and at the same level of central and lateral incisor. Here the picture at the top shows that the lower anterior teeth, their incisal edges are all at one level. The long axis of the lateral incisor is distally inclined. The long axis of the canine is more distally inclined than the lateral incisor. The picture below shows the profile view of the teeth. You can see that the central incisor is labially inclined, the lateral incisor is perpendicular to the occlusal plane and the canine is more lingually inclined.
As you know, the relationship between the lower anterior teeth and upper anterior teeth is either static or dynamic. The static relationship includes the vertical overlap, which is called the overbite, and the horizontal overlap, or what's called the overjet. The dynamic relationship is what we call the incisal guidance angle.
So the incisal guidance is the path on the lingual surface of the maxillary anterior teeth along which the mandibular anterior teeth glide during protrusion. In complete denture, an overjet of 1 mm creates an incisal angle less than 15 degrees. So the incisal guidance angle is formed by the amount of vertical overlap or overbite between the teeth when viewed in the sagittal plane. Now, to understand the effect of overbite and overjet on the incisal guidance angle, look at the middle of this slide. We have a right angle triangle where the horizontal arm is the overjet, the vertical arm is the overbite, and the angle, the 15 degrees here, is representing the incisal guidance angle. Look at the top left side of the slide where the overjet is fixed and the overbite is reduced, the incisal guidance angle is reduced. If we look at the top right side of the slide, if we increase the overjet while the overbite is fixed, the angle is also reduced. It's less than 15 degrees. If you look at the lower left side of the slide, if the overbite is increased while the overjet is fixed, the angle is increased, and if the overjet is reduced while the overbite is fixed, also the angle is increased. So the incisal guidance angle increases with increase in overbite and decrease in overjet. In complete denture construction, we need a shallow incisal guidance angle. So it is the best to enhance denture stability. We can achieve this by reducing the vertical overlap or overbite, but this may affect the aesthetics. So we usually tend to increase the horizontal overlap because it doesn't affect aesthetics or phonetics. Look at the first incisal relationship at the left. When the overbite is increased, the incisal guidance angle is increased. In the middle relationship, the overjet is increased, so the incisal guidance angle is decreased a little bit. In the third relationship at the right, the overjet is increased while the overbite is the same and the incisal guidance angle is decreased. Now, if we look at upper and lower 6 anterior teeth, the relationship at centric occlusion should be as that upper anterior teeth are set with an overbite of 0.5 to 1 millimeter and an overjet of 1 to 2 millimeters to establish a low incisal guidance of 15 degrees. There should be no contact between upper and lower anterior teeth at centric occlusion. There should be an equidistance overjet, and a shallow incisal guidance is very important to enhance the denture stability.
This slide shows the desired relationship between upper and lower anterior teeth after setting. As we said, there should be no contact and centric occlusion. There should be equal distance, equal overjet all around, and equal overbite all around, and 0.5 to 1 millimeter overbite and 1 to 2 millimeters of overjet.
Moving to the posterior teeth, we start with the first premolar, upper first premolar. From the buccal side, the long axis of the tooth is perpendicular to the occlusal table. From the profile or the side view, only the buccal cusp is touching the occlusal table, while the palatal cusp is above the occlusal table.
The picture on the right side shows that the long axis of the tooth or the central fossa of the first premolar is in a line with the crest of the upper ridge.
Upper second premolar, the long axis of the tooth is also perpendicular to the occlusal table. From the side view, both cusps are in touch with the occlusal table of the articulator. For the upper first molar, the neck of the tooth is more mesially inclined. Regarding the cusps, none of the cusps is in contact with the occlusal table except the mesopalatal cusp. If you look at the mesobuccal cusp, it's 0.5 millimeter above the occlusal table, while the distobuccal cusp is 1 millimeter above the occlusal table. If you look at the profile view, also only the mesopalatal cusp is in contact with the occlusal table. If we look at the occlusal view, the labial surface of the mesobuccal cusp is in a line with the labial surfaces of both first and second premolars, while the labial surface of the tooth, which I mean both for the mesobuccal and distobuccal cusps, is in line with the labial surface of the second molar. The upper second molar is more mesially inclined than the first molar. None of the cusps is in contact with the occlusal table of the articulator. The palatal cusps are usually longer than the buccal cusps, so we see them through the buccal cusps. The tooth is actually should be set buccally inclined as well. From the side view, none of the cusps is in contact with the occlusal table. The palatal cusps of upper posterior molars are on the crest of the mandibular ridge, and the occlusal surface of second molar is facing distally and buccally. When we look at the occlusal view of the posterior teeth after setting, there are two lines, the A line and the B line. The A line is formed from the distal surface of the canine, continuous with the labial surface of the first premolar and second premolar, and the labial surface of the mesobuccal cusp of the first molar, while the B line is formed between the buccal surface of the first molar and the buccal surface of the second molar. The angle between the A line and B line should be an obtuse angle following the shape of the arch. When the posterior teeth are arranged according to the previous description and considered as a whole unit, they form two curves, an anterior-posterior curve and a lateral curve. These curves are called compensating curves. Setting the lower posterior teeth is straightforward, following the upper posterior teeth. The long axis of the lower teeth should be at right angle to the occlusal plane. These teeth are set in centric occlusion with the upper posterior teeth, and this will be facilitated by reducing the size of the marginal ridges of upper and lower posterior teeth, and also by slight spacing of upper teeth, as you will see in the lab. Be sure that you have allowed sufficient buccal overjet when you set the posterior teeth. It's very important that the lower first molar is placed over the crest of the lower ridge and the central fossa occludes with the mesopalatal cusp of the upper first molar. This is considered the key of occlusion. So in centric occlusion, there should be maximum intercuspation between upper and lower posterior teeth. Every functional cusp should contact the opposing fossa or marginal ridge. In the lower picture, you can see that there must be a buccal overjet of posterior teeth, or what we mean the horizontal overlap, buccal horizontal overlap. So upper posterior teeth should overlap the lower posterior teeth. Now you should go through the tables in this slide and the next slide and know the contacts in the intercuspal position. So every cusp contacts with the opposing fossa or marginal ridge. You should know these by heart. So in centric occlusion, there should be maximum contact or maximum intercuspation between upper and lower posterior teeth and no contact between upper and lower anterior teeth. As the temporomandibular joint moves, the mandible moves. So we have a wide range of movements. So we don't only have the centric occlusion position, we also have eccentric positions, which are the protrusive position and the lateral position in both working and balancing sides. Remember that the working side is that to which the mandible moves. During protrusion in complete denture, the incisal guidance allows the incisal edges of the mandibular and maxillary teeth to touch. The posterior teeth should remain in contact. If there's no contact on the posterior teeth during protrusion, lower incisor teeth need to be lowered to provide balanced articulation. So we're playing with the incisal guidance here. So incisal guidance again is the path on the lingual surface of the maxillary anterior teeth along which the mandibular anterior teeth glide during protrusion. So during protrusion, the incisal guidance allows the incisal edges of mandibular and maxillary incisor teeth to touch, and also the posterior teeth should keep contact. Here, during protrusion, the mandible slides along the incisal guidance angle. Both anterior and posterior teeth should remain in contact in complete denture. This will enhance the stability of the complete denture. During lateral movements, remember that the working side is the side to which the mandible moves. At this side, we should have maximum contacts between upper and lower buccal and lingual cusps, while the balancing side is the other side, where functional cusps on upper and lower teeth should contact. We should get the maximum number of balancing side contacts. Both pictures here show that the mandible moves to the working side. Look at the contacts at the working side between the upper buccal and lower buccal cusps, upper palatal and lower lingual cusps, while on the balancing side we should have contacts between the functional cusps, which we mean the palatal, upper palatal cusps and the lower buccal cusps, or the inclines of the cusps. So here we need to introduce you to two new but related terms, balanced occlusion and balanced articulation. What's the difference between both terms? Balanced occlusion is the simultaneous contact between opposing artificial teeth on both sides when the jaws are in centric or eccentric relations. This is a static situation and applies when upper and lower dentures meet in any position. While balanced articulation is a dynamic situation where there are bilateral simultaneous contacts of opposing teeth in central and eccentric positions as the mandible moves into and away from the intercuspal position. So when we talk about balanced articulation, we are talking about the pathway, but when we talk about balanced occlusion, we are talking about the end stops. So why do we need balanced occlusion or balanced articulation? Why do we need it? Because it enables the denture to be seated during activities such as swallowing. If balanced occlusion is not present, the constant unseating of the denture will create soreness and inflammation, and this will accelerate bone resorption under the dentures. If balanced occlusion is not present, denture stability and retention and comfort will be compromised, and the patient won't be satisfied with the denture. In order to achieve balanced occlusion, we should understand the factors that affect balanced occlusion. We have 5 factors which are set on a way or on a balance. On one side, we have condylar guidance and incisal guidance of that balance, and on the other side, we have the orientation of the occlusal plane, the cuspal angle, and the compensating curve. So these are the factors which influence the balanced occlusion, and we will talk about them in details. The factors which influence the balanced occlusion are represented here: the incisal guidance angle and the condylar guidance angle at one side. On the other side, the compensating curve, the occlusal plane, and the cuspal angles of posterior teeth. These factors, these 5 factors, are called the Hanau's quint. The Hanau's quint, the scientist who worked on these factors, they were 8 factors, and he shortlisted them to these 5 factors, and he put them into this equation. The condylar guidance angle is the angle formed by the inner surface of the glenoid fossa and the horizontal plane, or the angle which the condyle makes with the horizontal plane when viewed in the sagittal plane during mandibular protrusion. Here is the definition of the occlusal plane, where it's an imaginary plane and it's related anatomically to the cranium. And in theory, this plane touches the incisal edges of incisors and the tips of the occluding surfaces of posterior teeth. It's not actually a plane in the true sense, but it represents the mean curvature of the surface when you connect between the incisal edges and the cusp tips of the posterior teeth. And this plane is established by the A latragus line or the Camper's line. The height of this plane is managed or governed by the height of the retromolar pad area posteriorly and the height of the lower cuspids anteriorly.
The other factor in the Hanau squint is the cusp angle. The cusp angle is defined as the angle made by the average slope of a cusp with the cusp plane. This angle is either measured mesiodistally or buccolingually. There are different cusp angles of artificial teeth. They could be 20 degrees or 33 degrees or with no cusp angle.
Theoretically, in order to have contacts between anterior and posterior teeth during all mandibular movements, the incisal guidance angle should be equal to the condylar guidance angle and also equal to the cuspal angles of posterior teeth. This is only in theory, just to represent the relationship between these factors. Do you remember the compensating curves, which we said they will originate after sitting of upper posterior teeth, after following the sitting rules? So the compensating curve is defined as the anterior posterior and mediolateral curves in the alignment of the occluding surfaces and incisal edges of artificial teeth, which are used to develop balanced occlusion. We will talk in details about all these factors in the next lecture and how to change or how to play with these factors to achieve balanced occlusion. But you should know the definitions and understand the factors very well before we talk about them in the next lecture. Thank you.